Hi, my name is Megan Porter, and I'm an infectious disease health educator at Maine CDC. And today I'd like to talk about ticks and tick-borne diseases in Maine. So let's just start with the very basics. Ticks are arachnids related to spiders, mites, and scorpions. So they have 8 legs, much like spiders, and they're all fairly closely related. We know that there are over 850 tick species worldwide, and about 90 of those live in the United States. Thankfully, of these, only a small number actually bite people and are capable of spreading germs to people. That's a huge blessing. We know that ticks can be found worldwide and on every continent except Antarctica. And we know that ticks have existed at least since the Cretaceous period. They may have been feeding on feathered dinosaurs, and they were definitely feeding on early birds. And the picture on the right shows a tick preserved in amber from the Cretaceous period. And the absolute coolest thing about this picture is that this tick looks very similar to the ticks that we see today. So, like spiders, as I mentioned, ticks have 8 legs, do not have antenna, and have a flat, hard body. We know that ticks are made up of about 3 basic parts. They have a capitulum, or mouth parts that they use to bite. They have the scutum or the shield located just behind their head. This is an important part in identifying a tick because it's the only part that doesn't change shape or size when the tick feeds and engorges or swells up super huge. Um, you can use the color, the pattern, and the shape of this shield to tell what kind of tick you're dealing with, even after they've been feeding for a long time and basically look like a grape. Then we have the abdomen or the stomach, and this is where all of the blood and the guts of the tick and any of the pathogens or the germs that they have in them are stored. Let's talk about how ticks move because this is a huge bit of urban legend, misinformation, whatever you want to call it, that's out there. Ticks cannot jump or fly. They will wait to ambush a host on grasses, shrubs, fence posts, anything like that. And we know that they cannot climb high enough to drop on you from trees. Almost every day, I hear someone telling me that they had a tick drop on them from a tree. Ticks only climb about 3 feet above the ground before they're in danger of drying out and dying. So there's no way that they can get up into a tree and drop on you. To find a good host, ticks use a behavior called questing. This is when they wave their front legs in the air. And on the tips of those front legs, they have what's essentially a nose or a sensory organ that they use to sense body heat, to sense carbon dioxide, moisture, movement, other chemicals that humans and animals put off. And once that host is near, they grab onto clothing or fur as the host walks by, a lot like a hitchhiker. They just grab a hold of you and hitchhike with you the rest of the way. Once the tick is on your body, it does crawl around looking for a good place to bite and feed, and this could be up in your hair, which is probably where a lot of the belief that they drop out of trees came from, because people would find ticks in their hair. The video on the screen shows an adult female deer tick who's doing some of that questing behavior. So we can watch as she stretches those front legs out, kind of waves them in the air, and she's looking for the heat and some of the other movement and other chemicals that my finger is putting off in this video. All right, let's also talk about how ticks bite because ticks need to feed for up to 10 days depending on their life stage. So they have to have specialized mouths that allow them to stay attached for such a long, long time. So yeah, there we go. Ticks have a mouth or a hypostome that has arrow-like barbs that they insert into their host. And these barbs or sharp teeth help keep the tick anchored in the skin. Remember, when a tick bites, the only part of the skin, or the only part of the tick, excuse me, that goes into the skin is this barbed hypostome. The rest of the tick stays outside of the body, but this hypostome forms a kind of a straw, and this is what the tick sucks blood through. Some ticks also make a cement in their saliva that literally glues this hypostome into the skin, which is why it can be so hard to pull ticks out. To help them bite, ticks also have two chemicals in their saliva. One is an anesthetic that makes the bite painless, so the host doesn't even know that they're there. This is why sometimes you won't know that a tick bit you until days later. The other chemical is an anticoagulant, and this keeps the blood from clotting because, again, ticks need to feed for a long time, much longer than it takes your blood to clot. And so they need to have that blood free flowing for a long time. All right. So what about the big ticks? We know that a tick can swell up to 10 times its body size when it feeds on blood. And this can make it super hard to tell which species of tick you're dealing with. When you find something that's raisin or grape sized, say on the floor of your house, what is this? Or when you pull off a tick that is just huge. Remember, the scutum does not change size or color as the tick feeds. That's really the only part that won't change size or color as the tick feeds, because especially the abdomen can change color drastically. So you can always look at the color and pattern on the scutum to identify which species of tick you have, because in this photo on the screen, both of these ticks are adult female dog ticks. Or excuse me, adult female deer ticks. But once she's been feeding for a couple of days, this female deer tick no longer looks red. Her abdomen is this dull gray color. She doesn't look the same. She's huge compared to what she used to be, but that scutum is still the same size and the same shape. All right. Let's talk about the ticks that are in Maine. There are 14 species of ticks that can be found in Maine, but thankfully only 2 of them regularly bite people, and really you'll probably only come across 2, maybe 3 of them. People and pets in Maine most commonly encounter deer ticks or black-legged ticks, which are shown in the top row, and American dog ticks, which are shown in the bottom row. You would recognize a female deer tick by that beautiful reddish orange abdomen. The rest of the ticks, the male ticks, and then the nymphal or teenage stage of that tick just kind of look black and blue. Whereas the American dog tick, which you're typically only going to see the adult stage, male and female, have those beautiful white, iridescent almost stripes on their back. So the male looks like it has racing stripes on the back. The female looks more like she has a necklace or a collar on her because her decoration is just on that scutum right behind her head. Less commonly, people in Maine may come across the woodchuck tick. The woodchuck tick tends to stick mostly around the burrows and nests of its preferred hosts, like woodchucks, but it will bite people or pets if it's given the chance. So if your dog sticks its head in a woodchuck burrow, it may come across some of these ticks and they may bite. All 3 of the ticks that we've talked about so far are considered endemic in Maine, meaning that they have thriving populations that live in the state. The 2 ticks on the slide, however, are not considered endemic in Maine. Instead, they're species that are invading other states south of Maine and could potentially move into Maine in the future. So starting with the Lone Star tick, this is found in the southern United States and is a super aggressive tick that has spread as far north as southern Massachusetts. We do have a handful of Lone Star ticks submitted and identified in Maine every year, but we don't believe at this point that we have any thriving populations in Maine right now. This tick is capable of spreading several pathogens that cause disease in humans, including ehrlichiosis, if you've heard of that. It's also associated with the red meat allergy or alpha-gal allergy, and this develops in some people after they're bitten by a Lone Star tick and makes them allergic to red meat, and we'll talk about that a little bit later. The longhorn tick on the right side of the screen recently invaded the US with the first tick identified in 2017. And so far, the ticks have been found in 19 states, including New York, Connecticut, and Massachusetts. What's really cool about this tick is that female longhorn ticks can reproduce and lay fertile eggs without ever mating with a male. So that makes them super successful. Also, the reason why, if you've heard stories of people coming across huge populations of these ticks, that's also part of that. We know that this tick can spread germs that can make people and animals sick in other countries around the world, but we don't know yet if these ticks can spread any of the tick-borne diseases that we have in the US out in nature. And research is ongoing, so we're looking forward to learning more about that. For the rest of the talk, we're going to drill down mostly to talking about the deer tick because they are one of the most common ticks in Maine, and they are the ones responsible for spreading all of the diseases that we have in Maine so far. So, deer ticks prefer to live in protected environments like forests rather than in open areas. And they're more common in deciduous forests with trees that lose their leaves each year, like oaks and maples. Deer ticks can often be found in the leaf litter on the ground where they can shelter from cold temperatures. And this also allows them to shelter from sun and wind, which can cause ticks to dry out. Deer ticks are really not capable of tolerating drying out. They're not super tough when it comes to that. Deer ticks can also be found in bushes and shrubs. These also provide food and shelter for the hosts that the ticks need to feed on, like deer, mice, and birds. As I mentioned, deer ticks especially cannot survive being dried out. And so that's why they tend to prefer these wooded areas. American dog ticks, on the other hand, are much tougher. They're kind of like little tanks. And so they thrive in grassy and open areas more than deer ticks do. So it's more likely that you'll run across American dog ticks out in a grassland. You're not very likely to find deer ticks out there. Deer ticks do not like to live in open, dry habitats without any protection from the sun, wind, or hydration. Though, if you look at the back of that field where it meets the forest, you could potentially find deer ticks on that forest edge right there. All ticks have 4 life stages that they go through. So ticks start as an egg, then develop into a larva or a baby tick, then a nymph, which is the teenage stage of the tick, and then finally into adult ticks, which can be male or female. While the nymphs and adults all have 8 legs, the larvae only have 6. So between the larval and nymphal stages, they do grow an extra pair of legs. So imagine if you had to do that in your life. For deer ticks, larvae are only about the size of a period in 12-point font. So picture that in your head for a second, and that's super duper tiny. Nymphs, or the teenage stage, are about the size of a poppy seed, and the adults are about the size of a sesame seed. So we're really talking about super small ticks. So when we look at this picture, both of these ticks are the same species. These are both deer ticks, but they look drastically different because they are different life stages, and so the size is totally different. So deer ticks are known as 3-host ticks because they only feed on 3 hosts during their entire life cycle, which lasts about 2 years when the conditions are ideal. And they actually spend the majority of their life off of a host entirely, just hanging out in the leaf litter. So in late spring, early summer, the eggs will hatch into larvae or the baby ticks, which look for a small animal host to bite and feed on. Usually they're looking for something like a white-footed mouse. Once they feed for 2 to 3 days, they drop off onto the forest floor, and this is where they're going to stay through fall and winter. Then they'll molt or grow into the next stage, which is the nymph or the teenage tick. So nymphs come out late the next spring, and they look for small to medium-sized mammals to feed on, something like a chipmunk or a raccoon. Once they find a host, they're going to feed for 3 to 5 days, and then again drop off onto the forest floor. Over the summer, the nymphs then molt into adults. So Genetically speaking, larvae and nymphs are male and female, but you cannot tell the difference by looking at them. Once they molt into adults, they are actually visually male or female. The adults come out in the fall and they're looking for a large-sized mammal. Uh, the poster child for the adult ticks is the white-tailed deer, where they get their name. So they are looking for a white-tailed deer, but if a dog or a human comes across, they won't have a problem getting on them and biting. The adults are actually looking for a mate on their large animal host. So that's why deer are super important. So they need to meet up with other deer ticks on that deer. So the adults mate on the host, and then the females will feed for up to 10 days before she'll drop off onto the forest floor, where she lays thousands of eggs and then she dies. If the adults do not find a mammal to bite in the fall, they will hunker down in the warm leaf litter on the forest floor throughout the winter and then come out to find a host. Anytime the temperature is above freezing, that could mean that they have to wait until early to mid-April, when we tend to see more consistent warmer temperatures. It could also mean that when we have that weird mid-February thaw that we seem to have every year, if they can get above the snowpack, they can be looking for a host as long as the temperature is above freezing. So the thousands of eggs that the female lays in the leaf litter hatch in the late spring into the larval or baby ticks, and then this whole cycle starts all over again. So different stages, life stages of the deer tick have activity peaks at different times of the year. We tend to see the largest activity peak of adult deer ticks in the fall from September through November, and then another smaller peak again in the early spring, usually April to May. We see the nymphal peak, so the teenage stage. We see their activity peak in June and July. Unfortunately, that's right when everybody wants to be outside and doing things in Maine. And then the baby ticks are most active in mid to late summer. In contrast, American dog ticks are active. All the life stages of American dog ticks are active from spring through the summer, with their peak usually coming in mid-spring. So to review, different species of ticks like to live in different habitats. Deer ticks like to live in forests, along woodland edges, and in forested suburban places. American dog ticks can also live in all of those places, but also in open fields and lawns as well. Woodchuck ticks mostly live in and around the dens or nests of their hosts, so more than likely you're not going to see them. Deer ticks can be active anytime the temperature is above freezing, with peaks of high activity in the early spring, summer, and again late in the fall. Dog ticks are active from April to August, with a peak in activity from May to June, and then woodchuck ticks are mainly active in the summer months with a peak in activity in July. Deer tick distribution in Maine is monitored through a tick submission program by the University of Maine Cooperative Extension Tick Lab. Deer ticks were first noticed in Maine in the mid-1980s along the southern coast, but they've now spread into every county in Maine. But still consistently the highest populations are in the down east, mid-coast, and southern regions of the state. The geographic range where ticks can thrive in Maine is partially driven by climate factors like precipitation, humidity, and degree days. So we're going to talk about some of these factors. So with precipitation, the link between ticks and rain is not as clear as it is with other pests like mosquitoes. When we get a bunch of rain, we know that mosquitoes are going to follow, right? But it isn't as clear with ticks, how those are linked. But we do know that it's important because it influences humidity. So as I mentioned before, ticks do not tolerate drying out, and they require a certain level of relative humidity in their environment in order to survive. If it's too dry, so think back to the drought during the summer of 2020, we hardly saw any ticks because they had to hunker down in the leaf litter on the forest floor just to survive. They couldn't be out looking for hosts because the fear was that they would dry out and die. And once they hunker down, they're actually able to absorb some of that moisture from the air around them, but they have to stay in that warm, humid environment. This does differ by tick species. American dog ticks, again, are a little bit more capable of withstanding some more extreme conditions, so they can be out for longer, but still, they're not capable of just completely drying out. Then we've got temperature, which is closely related to degree days. So degree days are essentially the number of warm days above a certain temperature in a year. And ticks require a certain number of degree days, so a certain amount of accumulated time above a certain temperature in order to complete their life cycle. So as the days get warmer earlier and earlier each year, ticks will have more and more degree days or accumulated time above a certain temperature within that year to help them develop faster and be more successful. Then we have to have the right host populations in the area. So tick populations depend on the animals, the suitable animals in the area around them. This is also true of the germs or pathogens that ticks carry. We need to have suitable reservoir hosts or hosts that allow the pathogen to survive and spread into new ticks in order to have that cycle uh, of, of pathogens going from animal to tick in order to set up that transmission cycle. And then we also need to have the correct habitat for ticks to survive. And we know that that's tied to climate-related factors. We've talked about the habitat preferences of the ticks in Maine. And we know that all of these factors together contribute to the increased survival of ticks, the increased reproduction of ticks, which can lead to larger populations. So not only will we have ticks spreading to new places in Maine, we'll have more ticks in the places in Maine where they already exist. And then we also have the potential increased reproduction of the pathogens that they carry within those ticks. So with tick-borne diseases, it's worth considering what the environment or the landscape is going to look like in Maine in the near future. So we talked about degree days on the previous slide. Deer ticks require 1,240 degree days above 42 degrees Fahrenheit in order for ticks to go from eggs hatching and going all the way through their life cycle to a female successfully laying eggs and having those eggs hatch into the next generation. So that whole cycle takes 1,240 days of accumulated heat above 42 degrees Fahrenheit. In these maps on this slide, areas in brown and white are areas with degree days every year that would allow deer tick eggs to hatch by the end of August. So essentially, we're saying deer ticks would be able to survive and thrive in these areas. And you can see that from 1980 on the left to the predictions through 2049 on the right, the amount of landscape in Maine where deer ticks can survive and thrive increases dramatically over time. By 2049, we predict that deer ticks will be able to survive and thrive in nearly all of Maine, with a few tiny exceptions that are shown in blue. And it's highly likely that the pathogens that they spread will also be able to survive and thrive in those areas. All right, on that kind of depressing note, let's move on to specifically talking about tick-borne diseases. It's important to note that anyone can get a tick-borne disease. No one's immune. But people who are at the highest risk of getting a tick-borne disease include people who spend more time outdoors, whether that's for work or for fun through hobbies, because these people have more potential exposure to ticks, but also children ages 5 to 14 years, and then adults over the age of 65 years. Each species of tick that we've talked about can carry different pathogens that can cause disease in animals. So these are the four species that we've talked about. All of the pathogens noted on this slide with an asterisk are not currently found in ticks in Maine. So these ticks are capable of spreading these pathogens, but we do not have either, in the case of the dog tick, we do not have these pathogens in our dog ticks in Maine. And with the case of the Lone Star tick, we don't have either the tick or the pathogens. And then just to back this up, through the tick testing at the tick lab, they have tested more than 3,000 ticks. They tested more than 3,000 ticks in the 2000 to 2002 period through those 3 years, and they did not identify any ticks submitted from across the state with Rocky Mountain spotted fever. So we are pretty confident that we don't have Rocky Mountain spotted fever in our tick population. All right, listed on this slide are some of the most common symptoms of the tick-borne diseases that are found in Maine. So they really include a lot of those flu-like symptoms that we talk about with some of our other illnesses. So fever or chills, headache, body aches, joint aches, fatigue, even abdominal pain or nausea. Specifically talking about Lyme disease, one common symptom of Lyme disease is the bullseye rash. And this is a slowly expanding, usually not itchy rash that classically looks like a bullseye, but it doesn't always have to look like that. This rash can appear anywhere on the body, not just where the tick bit you. So it's important to check all over your body for this type of rash. And it doesn't always have that nice round bullseye shape, but it will slowly grow in size. It's important to know that some people do get a little bit of redness right around the bite site. As long as it doesn't grow in size, this is not the bullseye rash. Some people just get a small immune reaction at the site of their tick bite, and this goes away on its own. So don't panic if you see a little redness, but do pay attention to if it's growing in size. If you don't catch the early symptoms of tick-borne diseases in the early days, they can progress to more severe symptoms. And some of these can show up weeks or years after the tick bite and be pretty debilitating. These can include arthritis, especially arthritis in big joints like the knees and the hips, neurologic memory and concentration problems, which can include Bell's palsy, which is a paralysis of some of the nerves in the face, and even encephalitis, which can be deadly in some cases. Heart problems, including carditis, difficulty breathing, kidney failure, and then anemia, which is the loss of red blood cells, which are super important because they carry oxygen around your body. Treatment for tick-borne diseases is most effective when it's started early. So if you think you might have a tick-borne disease, it's really important to talk to your healthcare provider. All right, deer ticks can carry the pathogens that cause Lyme disease, anaplasmosis, babesiosis, hard tick relapsing fever, and Powassan virus. All of these pathogens can be found in the ticks in Maine, but not all of the deer ticks in Maine are infected. And some deer ticks can be infected with more than one of these pathogens at the same time. So now we're going to go through a series of maps and graphs to talk about these pathogens and diseases in Maine. These maps show the distribution of cases of the three most common tick-borne diseases in Maine. So Lyme disease on the left, anaplasmosis in the middle, and babesiosis on the right. Since each of these pathogens is spread by the same tick species, the deer tick, we see a similar pattern of cases for all three diseases, which follows the distribution of deer ticks found in Maine. There is the highest activity in the southern and mid-coast regions for all three diseases, because this corresponds to the highest populations of deer ticks in Maine. And then cases of these diseases usually increase and even spread a little bit each year. Over the next few slides, I'm going to show you graphs of the number of cases of tick-borne diseases over time. This graph shows the increase of cases of Lyme disease reported each year to Maine CDC. And while there's some variation between the years, usually due to a combination of weather differences from year to year, like droughts, and changes in human behavior, like during the COVID-19 pandemic when we were under lockdown in 2020, we do see a generally increasing trend. This slide shows the number of cases over time of anaplasmosis on the left and babesiosis on the right. Again, since these are both spread by the deer tick, we see that the number of cases is generally increasing over time, just like with Lyme disease. But these diseases usually have fewer total cases each year, and that's due to a combination of factors. It could be due to environmental factors, with how the pathogens move from the tick to the host animal community and back and forth. It could also have to do with when they were introduced into Maine. This slide shows the number of cases over time of hard tick relapsing fever on the left and Powassan virus on the right. These are also spread by the deer tick, so we see that the number of cases is again increasing over time, just like with Lyme disease, anaplasmosis, and babesiosis. And again, these diseases usually have fewer total cases each year than the other diseases in Maine. And this graph shows the rate of Lyme disease cases in Maine over the past 10 years, broken up by age. We can see that consistently the two age groups with the highest rates of Lyme disease are adults over the age of 65 and children 5 to 14 years. Though in recent years, the 45 to 64-year-old age group has been inching up and actually maybe overtaking the 5 to 14-year-olds. So we may be adjusting and adding in a bit more education to try to encourage that age group as well to be really seriously using their prevention steps to prevent tick bites. All right, talking about some of the other pathogens that are not spread by the deer tick, ehrlichiosis is transmitted by the Lone Star tick, which again, luckily does not reside in the state. Maine usually has a small number of cases of ehrlichiosis each year, which we can see on this graph, but these are usually due to travel out of state to places where infected Lone Star ticks live, and then these people get sick, and that gets reported to us. We'll talk now about spotted fever rickettsiosis, which is a group of bacteria, and of these. This group, Rocky Mountain spotted fever, is the most common that's seen in humans. There are 3 ticks in the US that can spread the bacteria that causes Rocky Mountain spotted fever, and one, the American dog tick, does live in Maine. However, again, we do not have any evidence to date that the American dog ticks in Maine carry this bacteria. And to date, Maine has not had any confirmed spotted fever rickettsiosis cases, though in 2022, we had one probable case in a person who traveled to a place where infected ticks live and became sick. Again, switching gears a little bit, alpha-gal syndrome, which I briefly mentioned, is not a pathogen. It's an allergy, but since it is associated with ticks, we're going to talk about it now. Alpha-gal syndrome is a type of allergy to red meat, milk, and other products that contain that are from mammals. The allergy starts in some people when they get bitten by a Lone Star tick. During the Lone Star tick bite, the tick spreads saliva into the person, and some people, not all people, but some, will have an immune response to a compound in the tick saliva called alpha-gal. And this leads to an allergic reaction later on when they come into contact with the same alpha-gal compound in red meat, dairy products, and other mammal products. And this can include gelatin, broth, medicine ingredients, and some medical products like heart valves from pigs or cows, monoclonal antibodies, heparin, and even some antivenins. When people get this allergy, symptoms occur usually 2 to 10 hours after ingesting the product or exposure to the mammal product in whatever way. And these can include some of the classic symptoms of an allergy like hives, itchy rash, nausea, vomiting, heartburn, indigestion, diarrhea, cough, shortness of breath, swollen lips, tongue, throat, face, or eyelids, dizziness or faintness, and severe stomach pain. And what's really confusing is this is in people who have maybe eaten red meat all of their life, but they got a tick bite, and then sometime later, they start to develop this allergy out of the blue. Thankfully, you can avoid all of these tick-borne diseases and alpha-gal allergy caused by ticks by just preventing tick bites. And there are a lot of simple steps that we can use every day that are pretty accessible to all people to protect ourselves from tick bites and tick-borne diseases. And we break this up into talking about things that you can do before you go out into tick habitat, things you can do while you are out in tick habitat and what to do afterwards. So before you head out into tick habitat, follow these steps. So think about wearing protective clothing. And that means wear long sleeves, pants, and tuck your pants into your socks. I know that it's a super cool, trendy look, but it does make it difficult for the ticks to get in contact with your skin. Um, Even the lightest layer of fabric over your skin can prevent a tick from getting attached to you. Also, think about wearing light colored clothing like white or khaki, which makes a dark colored tick easier to see and pick off of your clothes. You can also think about treating your clothes with permethrin. Permethrin is an EPA-approved repellent that's used to treat your clothing, not for use on your skin. I accidentally got it on my skin once and it kind of tingled and burned, and I don't recommend it. You can buy pre-treated clothes, which are available at most sporting goods stores, or you can buy a simple do-it-yourself form, which is available at most places that sell insect repellents and have camping supplies. Once the clothes are dry, if you use the do-it-yourself form, you're ready to wear them and head out. And even better, one treatment, once you treat your clothes once, it lasts through several washes and it's waterproof. So if you have specialized clothes that you wear for gardening, outdoor sports, for camping or hiking, anything like that, these may be great clothes to treat with permethrin. You can treat them once and they can be good for a while. If you have pets that go outside, so like your dogs, maybe your cats, talk to your veterinarian about tick prevention, because animals that go outside, not only are they susceptible to some tick-borne diseases, but they can also bring ticks back into your house, which can get on other family members. Your veterinarian can help you choose whatever product is right for you and your pet's needs, but remember, you have to use it. It does no good sitting on the counter, sitting on top of the refrigerator, wherever you keep your products. They have to actually be used. Once you are out in potential tick habitat, think about taking these steps. So we talked about permethrin, but you want to wear an EPA-approved repellent that's useful for your skin. And we'll talk about that in a moment. Make sure that you know when you could be going into tick habitat. So remember back to the types of environments we talked about earlier in this presentation. Deer ticks love forested habitats. Unfortunately, for some of us, that means our backyard. If you're going out on trails, try to stay in the middle of the groomed trails. Ticks who are looking for hosts are going to get up on vegetation, and they love to get on the sides of trails waiting for a human or an animal to brush against that vegetation. So stay in the middle of the trail and try not to brush it up against any of the vegetation on the side. And then stop and check yourself periodically for ticks while you are out on the trail, out doing whatever it is that you are doing. Just stop, glance down, and remove any ticks that you see, because if you can prevent the tick from getting anywhere near you, that will help you prevent getting a tick bite. Let's talk a little bit more about those EPA-approved repellents. EPA-approved repellents for use on your skin include DEET, picaridin, IR3535, which may also be listed as ethyl butyl acetyl aminopropionate, or that really long name, and oil of lemon eucalyptus, which is an essential oil derived from plants. And these are for use on skin. Again, permethrin is not for use on skin, but is EPA approved and can be used on your clothes. Why do we go on and on about using an EPA-approved product? First of all, we know that an EPA-approved product means that the active ingredient in each of these repellents has been tested, and we know that it works to repel ticks, and we know how long it repels ticks before it needs to be reapplied. And this also means that we know the active ingredient is safe when it is used correctly. Always read the label instructions. Some of them have age restrictions. You don't want to use certain ones on children of a certain age. So just make sure that you're doing that safely. Overall, and more than anything, Maine is a beautiful state, and we want people to be able to enjoy it safely. So it's important that you use products that are effective against ticks. The last thing that we want is for someone to go out into the woods, enjoy the beautiful scenery that Maine has, thinking that they are protected, but then find out that the product that they were using, which was not EPA approved, did not protect them at all. All right. After you come in from spending time outdoors, especially if you've been all up in tick habitat, make sure that you follow these steps. You're going to want to check all over your body for ticks when you come home, and then again before you go to bed. Remember that ticks like to bite people in protected places on the body, so check especially closely in your hair and along your hairline, in and behind your ears, on your neck, in your armpits, along the bra line, in your belly button, along the waistline, in the groin, behind the knees, and then around your ankles. And remember that deer tick nymphs are super small. They might only be the size of a poppy seed. So don't just check by sight, also check by feel. And consider checking your pets too, because they can bring ticks into your home. It's a good idea to take a shower within 30 minutes to an hour of coming home because this can help you wash off any unattached ticks and help you do a really thorough tick check at the same time. And then when you come home, put your clothes straight into the dryer before you wash them. We know that ticks can come into our home on our clothing and they can actually survive in the clothing for several days. I came home once, I tossed the clothes that I had been wearing in the laundry hamper, and the next day I found a tick questing for a host on the side of my laundry hamper. So I could have avoided that by throwing my clothes directly in the dryer when I got home for 10 to 15 minutes on a high heat, because this kills any of the ticks that are hiding in the clothing. It dries them right out. As we know, they can't tolerate that and they die. Then you can throw your clothes straight into the washer like you normally would, and they're none the worse for wear. All right, so you've taken all of these steps, you've done the best you can, but you still find a tick attached. What should you do? The first step is to not panic. The second step is to remove the tick from your skin as soon as you can. It takes different pathogens, different amounts of time to spread from the tick into a person or an animal when they bite. And so the sooner you can remove the tick, the better. Usually it takes at least 24 hours for these pathogens to spread from a tick into a human, usually more like 36 to 48. But in the case of Powassan virus, it may be able to transmit within 15 minutes, which is why we recommend prevention so much if you can prevent that bite in the first place. But this is also why it's super important to remove ticks just as quickly as possible, because you just want to get that tick away off of your skin and remove the chance that it can spread any more pathogen into you. So we recommend using a tick spoon or fine-tipped tweezers to remove the tick. This is the fastest, most effective way to do it. Do not use petroleum jelly, a hot match, a lighter, nail polish, or any of those other products or methods that you may have seen online. These really are more likely to just disturb the tick. They might encourage it to spread germs faster if you irritate them. There's also just the risk these are just going to take too long. A lot of these methods rely on suffocating the tick to get it to come out. Unfortunately, ticks don't breathe like we do, and so it takes them a long time to suffocate. And so you're really just playing with time that you don't really want to mess with that. So just remove the tick as quickly as possible. We've got instructions here on this slide for how to remove a tick. With the tick spoon, you're just going to want to fit that notch right around the head of the tick and scoop it out. With the fine tip tweezers, the trick is to grab the tick as close to your skin as possible. You don't want to grab the tick in the middle of the body because you don't want to goosh any of that tick guts into you. That's not the goal. You want to just pull it from the mouth parts right out of your skin. All right, what should you do with the tick once it's removed? Ticks can be super difficult to kill, and they can continue to crawl around and they may look for someone else to bite after you remove them. So if you throw them in the trash, there is the risk that they could crawl back out. We always recommend just putting your tick into a container of rubbing alcohol or hand sanitizer because that will kill the tick and preserve it if you decide to test it later. If you don't have any rubbing alcohol, just put it in a sealed container to dispose of it in the trash. That way it's not going to be able to crawl back out. The Tick Lab does offer free tick identification and testing for a fee of $20. They do test deer ticks for Lyme disease, anaplasmosis, babesiosis, hard tick relapsing fever, and Powassan virus. And for surveillance purposes, they do test American dog ticks and Lone Star ticks for ehrlichiosis, Heartland virus, Rocky Mountain spotted fever, and tularemia. And you can visit this link right here for more information on how you could go about submitting your tick if you're interested. But just know that you shouldn't be making decisions about your health based on tick testing. Tick testing is super helpful to us for surveillance purposes so that we know where people are finding ticks in Maine and what those ticks may be infected with. But the best gauge of your health is how you are feeling. So if you have symptoms, you need to talk to a healthcare provider. Don't make decisions about your health based on tick testing results. So what should you do if you start to feel sick? The first step is if you start to feel unwell after a tick bite or after you've spent time in tick habitat, talk to a healthcare provider. And make sure that you mention, hey, you know what, I had a tick bite a couple weeks ago, or, you know, I went camping or hiking, and it's possible I got bitten by a tick, just so that they can have tick-borne diseases on their list of possibilities. For the most part, a doctor is going to order a simple blood test to look for evidence of these pathogens. Most tick-borne diseases can be treated with antibiotics, though there is no treatment for Powassan encephalitis. Most of those symptoms can be treated with over-the-counter drugs, but severe Powassan may require supportive treatment in the hospital. So in addition to personal bite prevention and tick checks, there are some things that you can do, some steps you can take to keep your yard and your home safe from ticks. The first things you can do is to keep your lawn mowed and then keep leaves raked and get those leaf piles out of your yard, out of the places where you want to spend time either working or having fun in the yard. You could also move wood piles away from the house and any recreation areas and move bird feeders away from the house and garden, yard toys, things like that. These steps all help to reduce the amount of habitat around your yard where ticks and their hosts can live. So things like birds, things like mice, the areas where ticks are going to hunker down to stay warm. This removes all of those from the places where you want to spend time in your yard. You can also create a border around your yard with crushed stone or wood chips. This is going to provide a barrier that keeps ticks from crawling across it into your yard. If they try, they're going to dry up and die before they can get into your yard. Finally, here at Maine CDC, we have a lot of information. So if you're looking for information about vector-borne disease information, whether that be ticks or mosquitoes, you can go to the link provided on the screen. We do have our 24-hour disease consultation line, which you can call or you can email us if you have questions and you can't find the answer to them about ticks or tick-borne diseases. And then finally, we have a lot of really cool materials that you can order, posters, handouts, brochures, things like that. So make sure that you visit that, especially if you have a business, if you live near an area where people are going to spend a lot of time going out into tick habitat. This may be a good resource for you. And thank you for joining me and learning about ticks today.